Today, we live in an age of pandemics, endemics, and outbreaks. And the Marburg virus is just another pathogen to add to the list of germs threatening to cause a major pandemic around the world. Here is what we need to know about the Marburg virus. Earlier this month, for the first time in its history, Ghana announced an outbreak of the deadly Marburg virus disease. A 26-year-old man and a 51-year-old man both presented to the same hospital and died a few days apart. They presented to the hospital with symptoms of diarrhea, fever, nausea, and vomiting. Within days, a team of WHO experts scrambled to the area, tracing contacts and collaborating with emergency response teams. A Marburg virus outbreak had only occurred in West Africa on one occasion before that, in August of 2021 in Guinea. What was all this fuss about? The Marburg virus is a close cousin of the Ebola virus. They are both viruses that cause hemorrhagic fevers and belong to the same family known as filoviruses. Before 2013, Ebola virus outbreaks were relatively small and never sickened more than 600 people. Then, in 2013, all hell broke loose. 28,000 people became infected in Liberia, Sierra Leone, and Guinea. A group of scientists from Harvard and the University of Massachusetts claimed to have compelling evidence that mutations had caused the Ebola virus to develop a preference for human cells. And this had caused the explosion of Ebola virus in 2013. Today, we're in the throes of a COVID-19 pandemic that is far from over and a monkeypox global health emergency that has people swarming to get vaccinated. Is the Marburg virus outbreak in Ghana a result of new mutations in the virus that have made it more contagious? In August of 1967, while working to develop a vaccine for polio, scientists in Marburg and Frankfurt, Germany, and in Belgrade, in today what is Serbia, developed fever, chills, muscle aches, and vomiting, which worsened over the next few days. They then began bleeding from every orifice in their body, including needle puncture wounds. In total, 31 people fell ill, and 7 lab workers died within about a week. 3 months after this outbreak, virologists in Marburg isolated the first filovirus from their specimens, the deadly Marburg virus. From 1975 to 2007, sporadic outbreaks took place in South Africa, Kenya, the Democratic Republic of the Congo, Angola, and Uganda. Then, on July 5th, 2008, a 41-year-old Dutch woman was referred by her doctor to the Eikerleek Hospital in the Netherlands for fever and chills of 3 days duration after returning from a holiday in Uganda. She was placed in a room with 3 other patients. After admission, she developed a rash with conjunctivitis and diarrhea and liver and kidney failure. Finally, she started oozing blood from all over her body. On July 7th, because of her rapid deterioration and developing liver failure, her doctors tested her for hemorrhagic fever. On July 10th, Marburg virus disease was confirmed by PCR testing. The following day, July 11th, the woman died from complications of brain swelling. The woman, along with 2 other tourists and a guide, had visited the Python Cave in Marburg Forest on June 19th. Her partner recalled bats flying around in the cave, bumping into the visitors, and piles of droppings scattered all over the ground. On June the 23rd, the travel party came to within 5 meters of gorillas in the wild and visited a village inhabited by pygmies where they saw a sick elderly woman lying under a blanket. That same year, another visitor to the cave, an American woman by the name of Michelle Barnes, barely survived after a long and painful illness. The Ugandan government closed the cave to tourists in 2008. Marburg virus was detected in bats for the first time in 1999, including the Egyptian rosette bat in the Democratic Republic of the Congo. The bat is a natural host of the virus and is not sickened by it. Marburg virus may spread to humans through infected intermediate animals such as non-human primates and pigs. Once the Marburg virus enters the human body, it can spread between humans if there is contact with the bodily fluids of infected persons. For example, their feces, their blood, their urine, their saliva, their tears, their mucus, their sweat, their vomitus, their amniotic fluid, or breast milk. Infection can also occur if the fluids are on a surface or material such as clothes or bedding. The virus can persist in the eyes and the testes of people who have recovered, and in pregnant women in the placenta and the amniotic fluid and breast milk. It may spread through sexual intercourse because viral antigens have been found in the semen of infected men. We now know that the virus can survive for as long as several days on contaminated surfaces, and that the inappropriate handling of human corpses can transmit the disease. Scientists now suspect that the virus is transmissible through the air in aerosol. The illness starts abruptly with high fevers, severe headaches, and malaise after an incubation period of 2 to 21 days. Muscle aches and cramping pains are also common features. Approximately the fifth day, a slightly raised rash may occur, after which nausea and vomiting, chest pain, sore throat, abdominal pain, and diarrhea may appear. In fatal cases, death usually occurs in 8 to 9 days and follows bleeding from the gums, the nose, the skin, the eyes, and multi-organ failure. Fatality rates range from 24 to 88%, depending on the strain of the virus and the quality of care. There are still no antivirals or vaccines approved to treat Marburg virus, so treatment is symptomatic and supportive. A range of potential treatments, including blood products, immune products, drug therapies, as well as candidate vaccines, are being evaluated. The Marburg virus can spread beyond the borders of those countries where it is endemic, as we saw in the cases of the Dutch and the American women in 2008. The WHO calls the disease epidemic prone, meaning that it can spread easily between people if it is not prevented. If the virus mutates and becomes more contagious, it can cause widespread disease, possibly leading to a pandemic. So how can we prevent the spread of this deadly virus and avoid another global health emergency? We must prevent human infection, because the more people the virus infects, the more likely it is it will develop the capability of spreading more easily among humans. When caring for infected persons, healthcare workers should wear protective gowns, gloves, and masks. Infected persons should be placed in strict isolation, and needles, equipment, and patient excretions should be sterilized and properly disposed. We must dispose of laboratory specimens properly and ensure that safe burial procedures are followed. People must be discouraged from handling or eating bushmeat, and they should avoid bat caves. Ultimately, a rapid diagnostic test will be needed to screen travelers who might have been exposed. I hope you found this video informative and useful. If you did, like and share the video with friends and family. And don't forget to subscribe to the channel. I'll see you in the next video.